To another video, and in this video I'm going to walk you through how to apply for a home care license for the great state of Kansas. Great state of Kansas has made the application process very simple and straightforward. So what I'm going to do is I will also include these links that I'll be showing you in the description of this video so you can have easy access to them. So let's get right into it. The first page that we'll cover is for the Kansas Department of Health and Environment, so Division of Public Health, pretty much. When you come to this page, you're going to see the application for State Home Health Agency licensure. They have an option for you to click for the applications and instructions for Kansas Home Health Agency licensure process, and it's a PDF form. So once you click on that, you'll be redirected to a different page. It says here, submission of the Home Health Agency application state licensure form also requires a fee, and we'll cover that once I show you what the PDF looks like. The Kansas Department of Health and Environment currently accepts only checks or money orders for these fees made payable to Health Facilities Program or KDHE. I believe that KDHE stands for Kansas Department of Health and Environment. So once you click on this link, it'll take you to this page, which is a PDF. Now don't be intimidated now. There are 90 pages to this PDF, but I want to make sure that you're diligent when you're dealing with this application process. What this means is that be sure to go through every single page to make sure you don't miss anything. But for the sake of this video, I'm not going to cover every single page. That's going to be up to you to do your due diligence. What I'll do is I'll cover some of the top level, high level details that I think you should pay attention to. The first page covers the instructions for Kansas Home Health Agency application, obviously, and then it gives you an option to apply for what they classify as Classification A, which is the skilled serviced agency, or Classification B, which is a non-medical service. Now let's skim through the second page. It says here, please keep your submission requirements and instructions guide handy, as you might need to refer to it if there are any missing documents. They are encouraging you to keep copies of everything that you're going to submit, which is pretty common sense, in my opinion. Here it lists out the address where you need to submit your application to. And then you need to make sure you address it to this lady right here. I believe it's a lady, Lois Wilkins. And then that's the full address in Topeka, Kansas. Let's go to the next page. So here is something you need to pay attention to that's highlighted in yellow. So what they're saying here is that everything that's going to be highlighted in yellow coming up is going to be pertaining to the Class B licensure, which is the non-skilled. So Class A, let's go back again to the differences between Class A and Class B. So here, Classification A is the skilled, and then Classification B is the non-skilled services. So everything that is going to be highlighted in yellow is going to be pertaining to the non-skilled. If you're going to apply for a Class A, which is the skilled agency, be sure to include everything that is in the non-skilled requirements category. Also include those in the Class A, which is the skilled agency requirements. That's all they're saying here. Let's move on. Here they say for questions and or concerns regarding licensure and or application process, it says contact Lois Wilkins, and her email is right there. So I encourage you to email her if you need to. There's a phone number right there, and there's also a second person you can email as well if you have any questions. and of course an address, fax number, etc., right there. Next is the 2 levels of state Kansas HHA licensure that I just described earlier, and everything about the differences between the non-skilled and the skilled according to the state of Kansas is all listed out in this page 4 and 5 and page 6 a little bit. Next is some helpful links that you might need, but for your sake you'll just be dealing with this one right here, which is Home Health Agency State Licensure Application. So this is all you need to worry about. But if you needed any more additional information about Medicaid, Medicare, all that stuff is listed right here, and you can download the forms, read up on them. It takes you just a couple hours, maybe a couple of minutes, depending on how fast you are at skimming through this or reading this. Next is policies and supporting template forms. For most states that require you to have a license to operate a home health agency, they do require you to have what are called policy and procedures. This is mandatory. A lot of people get jammed up on this process because they don't know how to put together policy and procedures. Well, I have good news for you, and stick around to the end and I'll show you what I have for you. But for the state of Kansas, they were kind enough to give you a checklist of everything that is required in order for you to put together your policy and procedures. Now here on page 9, they list out every single thing that is required here. So it says here's a checklist of many of the required policies to help you organize what is needed. Additionally, be prepared to provide the template form for each. Also, please note that this list is not all encompassing and others may be required. So what are some of the things they're asking for here? They're asking for things like job descriptions for all listed staff positions. They're asking for an org chart. They're asking for personnel policies. So things like, how do you interview staff? Do you conduct reference checks? Do you do background checks? Do you do TB screening? If you scroll down a little bit more here, you'll start to notice the difference. Again, back to Class A and Class B, non-skilled versus skilled. Everything that is highlighted in yellow is going to be for the Class B non-skilled. So if you're submitting a non-skilled application, it means that you need a policy for client acceptance. You need a policy for on-call workers. You need a policy for worker services. You need nursing services, therapy services, nutrition services, so on and so on. As I mentioned earlier, a lot of people get jammed up on this because these policies are a lot of documents, right? And a lot of people get jammed up on this because they don't have time, and putting together your own documentation is time consuming. But the good news is I have some templates that you can use. After dealing with so many people in the application process, I've come to realize that this is something that you will need. I've made it super simple and easy for you to be able to submit your policy and procedures. So if you're ready to submit your application, all you have to do is click on this link. You click on I want this, and then you can purchase these templates that I have for you. And these templates, I've designed them in such a way that they're applicable for any state. I've had dozens and dozens of people purchase these templates from me. And all you have to do is plug in your company's information, edit them a little bit based on the agency's needs or the state's needs, but pretty much everything that is on the checklist here, I have already. So things like patient acceptance, client acceptance policies, I already have those in these templates already. and they're ready to submit to the state. And guess what? You've saved yourself a lot of time and a big headache. So I hope you got some value from this video. Again, I will be sure to put the link to these policy and procedure templates in the description of this video so you can make a purchase and be compliant with the state of Kansas as quickly as possible and save yourself the headache. I hope you got some value from this video, and I will see you in the next one.